R2101, ambulance traffic, possible drug OD, 829 Lincoln Ave, south of Brockton.
2101 I'm Mark Spawn. Recently there have been some stories of police confiscating legally issued naloxone overdose kits that have been found on people during encounters with law enforcement. You should know that the issuance and possession of these kits are authorized under Section 3309 of the New York State Public Health Law and regulations by the Commissioner of Health. Opioid overdose is a national epidemic. According to the CDC, U.S. overdose deaths involving prescription opioid analgesics increased to about 19,000 deaths in 2014, more than 3 times the number than in 2001. There are overdoses every day among persons who use illicit opioids such as heroin, and among those who misuse medications prescribed for pain such as oxycodone, hydrocodone, and morphine. The incidence of opioid overdose is rising nationwide. In 2014, more than 28,000 overdose deaths involved some type of opioid, including heroin. So it's obvious we have a problem, an epidemic. But we have a tool to help us save lives. Hundreds of overdoses have already been reversed because of the availability of naloxone in the field by police, fire, EMS, and the general public. Naloxone blocks the effects of opioids in the brain. Without it, an overdose victim's breathing can decrease or stop. Many family members of drug users have the kits, as well as drug users themselves who are sometimes in a position to witness and reverse an overdose sooner than emergency services. The appearance of the kits can vary. Some are intranasal atomizers, others are syringes with vials of naloxone. They could be in a labeled pouch or in a zip-top bag. And the law does not require a person to possess proof of having taken a naloxone course, nor to carry a prescription, receipt, or other proof. And remember, naloxone obtained and possessed under the Opioid Overdose Prevention Program, whether as a first responder or as a citizen, are lawfully possessed. If you seize it, you could be taking away the dose that could save someone's life. I'm former Police Chief Mark Spawn. Thanks for joining me for what's happening in harm reduction.